The landscape of public health in the United States faces a potential upheaval. Robert F. Kennedy Jr., now the U.S. Health Secretary, has pledged to ban water fluoridation nationwide. This proposal has ignited a firestorm of debate, pitting long-standing public health practices against rising skepticism. Kennedy, known for his anti-vaccine advocacy, views fluoride as harmful. This stance departs from decades of established health policy supported by major health organizations globally. Water fluoridation has been a cornerstone of preventive dental care, credited with reducing tooth decay. Dismantling this system would be a massive, uncontrolled experiment on the dental health of millions, particularly children. The timing is critical, as community water fluoridation faces intense attacks across the country. Kennedy's move taps into a broader distrust in public institutions and scientific consensus. The debate must be grounded in facts, not fear. The stakes are incredibly high for the future of preventive medicine in the United States. The potential consequences of a nationwide fluoride ban are not speculative. A new Harvard study projects that within 5 years, a ban could lead to 25.4 million additional decayed, missing, or filled teeth among children and teenagers. The financial toll is staggering, with direct dental bills estimated at $9.8 billion in the first 5 years. This figure excludes indirect costs like lost wages for parents and long-term health complications. Over a decade, the number of additional decayed teeth could reach 53.8 million, with direct costs escalating to $19.4 billion. The study also estimates a loss of 2.9 million quality-adjusted life years, QALYs, for children in the first 5 years. These projections serve as a serious warning against dismantling a proven preventive measure. The numbers demand careful consideration from policymakers. A fluoride ban would disproportionately impact vulnerable populations. The burden of increased tooth decay and escalating dental costs would fall most heavily on low-income families, rural residents, and those on public health insurance. These communities benefit most from community water fluoridation. Removing this protection would lead to more dental problems that these families are least equipped to handle. Children in rural areas face long travel times to dental clinics and a scarcity of providers. A ban would strip away essential safeguards, leaving rural children at higher risk of dental disease. The increased need for restorative treatments would strain local healthcare resources and family budgets. Water fluoridation is a public health success story with a long history in the United States. It began in 1945 in Grand Rapids, Michigan, following research that observed lower rates of tooth decay in communities with naturally occurring fluoride. The CDC hails community water fluoridation as one of the 10 great public health achievements of the 20th century. Fluoride strengthens tooth enamel, making it more resistant to acid attacks and helping to remineralize enamel. Despite its proven benefits, water fluoridation has faced opposition, often fueled by misinformation and conspiracy theories. At the controlled levels used in public water systems, the overwhelming scientific consensus is that fluoridation is safe and provides substantial dental health benefits. The pledge by Robert F. Kennedy Jr. to ban water fluoridation underscores a dangerous trend: the elevation of misinformation over established scientific evidence. Attacks on fluoridation are fueled by fear-mongering and distrust of institutions. The Harvard study authors state that at current U.S. fluoridation levels, the benefits are clear. Major health organizations worldwide support community water fluoridation as a safe and effective measure. Addressing misinformation requires proactive communication of fluoridation's benefits and safety. Media literacy initiatives can help individuals critically evaluate information. The decision to continue or abandon water fluoridation should be guided by scientific evidence and public well-being. The potential consequences of a ban, millions more cavities, billions in avoidable costs, and a disproportionate impact on vulnerable children, are too severe to ignore. Protecting the dental health of the nation requires upholding proven public health interventions and resisting policies rooted in misinformation.